Dear students, still now we have discussed about Pandaroga, its Nidana Panchaka, Sadhya Sadhyata. So in this video we are going to discuss about the contemporary understanding of anemia. Anemia is a decrease in total amount of RBCs or hemoglobin or a lower ability of blood to carry the oxygen. See, most of the time students will think that if the HB is reduced, that is the anemia. No. HB is reduced, HB is one of the criteria to define it as the anemia. Even if the total count of RBC is reduced, then also you can tell that it is the anemia, but hemoglobin might not have reduced. So that is discussed. Then hemoglobin is lower, or RBC is also okay, hemoglobin is also okay, but its oxygen carrying capacity of the RBC is reduced. Then also we consider it as the anemia. So how to make the diagnosis of anemia? First important is always the patient's history. See for clinical presentation, most of the anemia cases will be diagnosed on the clinical setup. Then only the laboratory investigation will be. So first take the clinical history properly, see for signs and symptoms of anemia. Examination, physical examination, in particularly the panel examination will help to make the diagnosis of anemia. Then see for what are the signs and symptoms exhibited by the patients. So different signs and symptoms, then we will go for hematological laboratory findings. So what is the importance of the laboratory investigations in anemia we will also discuss. So at the end, to make the confirmation of the diagnosis of anemia, we need the hematological investigations. There are many reasons for the anemia. First one is the nutritional deficiency. If the person is having the nutritional deficiency, then it will lead to the anemia. Second one is the external or internal blood loss, hemorrhages, external hemorrhages or the internal hemorrhages due to any reason will lead to the sudden anemia. Okay, if the person is met with a road traffic accident and he has a severe bleeding, then there will be the anemia. For that only we will make the blood transfusion in those cases. If the person is having some coagulation difficulties, coagulation disorders, internal bleeding will occur, then also it will lead to the anemia. Increased destruction of the RBC. So this is another very important causative factor for the anemia. The RBC has to go for the destruction in the spleen, reticuloendothelial systems. But if that process is increased, so some disorders like malaria, dengue, where there will be the RBC destruction. So malaria parasite will reside in the RBCs and it will destroy the RBCs. Then also it will make the increased destruction of RBCs or the increased function of spleen leading for the splenomegaly. Then also there will be increased destruction of the RBCs will lead to the anemia, infective or the decreased production of RBCs. So the RBCs are produced from bone marrows. There are some disorders, infective disorders, some viral and the bacterial infections which will suppress the production of the RBCs. That also will lead to the anemia. So these are a few and the important causative factors for anemia. Next is abnormal hemoglobin synthesis. So if the hemoglobin synthesis is deranged, then also it will lead to the anemia. Bone marrow suppressions, like bone marrow suppressions by toxins, chemical or the radiations. In all these cases, there will be the decreased RBC count. RBCs are not produced well, even the hemoglobin is not produced well. Infections, then bone marrow replacement by the malignant cells. These all will lead to the abnormal hemoglobin synthesis. Coming to the signs and symptoms of anemia, most of the time the patient will not exhibit a specific signs and symptoms. Most of the time it will be the non-specific signs and symptoms will be seen in the patients. Patient will tell that because even the HP is reduced, the body will adjust to that HP percentage, so that the patient will not feel any much difficulty. When he feels the difficulty, he will neglect it. So patient will show some non-specific symptoms like fatigue, headache, faintness. Patient will come and will tell that I have a continuous fatigue, or the headaches, or the faintness, the sudden darkness. Then you can think that person may be suffering from the anemia. Breathlessness, if the severe anemia is started, then the person will start breathlessness because of oxygen carrying capacity is reduced, but the demand is more, so then breathlessness starts. Intermediate claudication, palpitation. So when the HV is reduced, heartbeat will increases, and the person will start feeling of his own heartbeats and waiting for palpitation. So these are very vague, non-specific symptoms you can see in a classical anemic patients. Coming to signs, when you are suspecting about the anemia, go for a detailed physical examination which will give the most of the time the diagnosis of the anemia, right? The pallor. Check the pallor at palpable conjunctiva, tongue, oral cavity, then palms and the soles, and the face. If you see them, if you observe that if the patient is having the paleness, then definitely person's hematology is deranged, person may be having the anemia. Go for the auscultation, person will have that tachycardia, sometimes chemic murmur. These are the systolic flow murmur. You can see in the anemia, person has the anemia. If you hear the heartbeats, there will be the systolic flow murmur. They are also called as chemic murmurs. Cardiac failure, very severe cases we find cardiac failures, CCF, etc. Rarely papilloadenoma and retinal hemorrhage after an acute bleed can be seen. So these are the signs and the symptoms of anemia. So clinically, the diagnosis of anemia is totally depending on the history of the patient. First we told about the history. So then take the history of the patient, that is what is his dietary habit. Most of the time the nutritional deficiency or the malnutrition will lead to the anemia. So take the history of the diet. Any medications, there are some medications which will lead to the anemia. Possible exposure to the chemical and the toxins, the occupational hazards, description and the duration of the symptoms. So since how many days it started and when it will start the symptoms. That will also help for the pinpointing the diagnosis. Tiredness, then muscle fatigue and the weight weakness, headache, vertigo. Sometimes patient will exhibit with the vertigo or the dizziness. Dyspnea, GI problem, then oversight of the blood loss such as hematuria, etc. So this is for the clinical symptoms of anemia. Physical examination, general finding might include hepatosplenomegaly, because in hepatosplenomegaly there is the increased destruction of the RBCs and also may lead for the anemia. Heart abnormalities means the murmurs and the palpitation, tachycardia can be seen. Skin pallor, specific finding may help to establish the underlying cause. Okay, so vitamin B12 deficiency may be a sign of malnutrition and the neurological change. See for vitamin deficiency signs, then you can also interpret that the person is having the malnutrition. Iron deficiency, which is a major cause, and the most of the scenario you will find the iron deficiency leading for the anemia, the severe pallor, smooth tongue, and the esophageal wells will give the idea of the iron deficiency anemia. Hemolytic anemia, there may be the jaundice, hemolytic jaundice, or malaria, or the dengue-like symptoms you can see. Okay. Now coming to the types of anemia. So the types of anemia. There are three types of anemia. One is microcytic anemia, macrocytic anemia, and macrocytic anemia. See, so this is the pathological types of anemia. Microcyte means the RBC size is reduced and there is anemia. RBC size is normal but hemoglobin concentration is reduced. Macrocytic RBCs are increased but also there is a decrease in hypochromia, decrease in chromicity or leading for the anemia. So we see that with the pictures, what is macrocytes, what is macrocyte, and what is the normocytic anemia. First one is a microcytic anemia. How to know about the microcytic anemia and what are the causes? Iron deficiency anemia will lead to the microcytic anemia. Anemia of any chronic disorder, the person is suffering from any chronic disorder may end up with the anemia, which will be a microcytic anemia. Alpine beta thalassemias, sideroblastic defects like hereditary sideroblastic anemia, acquired sideroblastic anemia, including lead toxicity, reversible sideroblastic anemia, these all will lead to the microcytic anemia. Coming to the macrocytic anemia, so macrocyte means the RBC size is increased. Like the megaloblastic anemia, the most common cause of the macrocytic anemia is due to the deficiency of vitamin B12, folic acid, or the if the person is having vitamin B12 and folic acid deficiency, then it will lead to the macrocytes. Deficiency in folate or vitamin B12 can be either to inadequate intake or insufficient absorption. Person is taking the adequate nutrition but there is a malabsorption syndrome. Then also person may end up with the anemia, which will be the macrocytic anemia. Most of the malabsorption syndrome will end up with the macrocytic anemia. Patient will tell that I am eating a very good amount of the food but it is not digesting and I am not getting the weight and I am getting the anemia. Then it is due to the malabsorption leading for macrocytes. Or if the person is not taking, then also it will lead to the macrocytic anemia. Pernicious anemia is caused by lack of intrinsic factor, which is required to absorb vitamin B12 from the food. Then a lack of intrinsic factor may arise from the autoimmune conditions targeting the parietal cells that produces the intrinsic factor or against the intrinsic factor, etc. So to absorb vitamin B12, there is a need of some intrinsic factor. If they are not absorbing, they are not producing, then lead to the macrocytic anemia, in particularly vitamin B12 deficiency macrocytic anemia. Macrocytic anemia can also be caused by a removal of the functional portion of the stomach, which during gastric bypass surgery. So in the olden days, a severe gastric ulcers, the surgeon used to go for gastrectomy. At that time, some part of the stomach is removed. Even nowadays, for excessive obesity or morbid obesity, we go for the gastrectomy. Some part of the stomach is removed. So when you remove the part of the stomach, then it will lead to the non-absorption of vitamin B12 and the folic absorption, leading for macrocytic anemia. Hypothyroidism, nowadays most of the people with the hypothyroidism will see that they will be having macrocytic anemia. Alcoholism, which causes macrocytosis, although not specifically for the anemia. Alcohol will directly affect on the liver and leads for the macrocytes, but the anemia is a question. Okay. Some drugs like methotrexate, zudovarin, others may inhibit the production of DNA applications such as methotrexate. Methotrexate in the autoimmune disorders, zudovarin in HIV infections, these all will make the immune suppression, leading for the macrocytic anemia. Coming to the normocytic anemia occurs when the overall hemoglobin levels are decreased, but the RBC size remains normal. RBC size is normal, but there is a reduced hemoglobin level, like in acute blood loss, anemia of the chronic diseases, aplastic anemia, bone marrow failure, then hemolytic anemia. So most important is hemolytic anemia or the acute blood loss. The person is having a hemorrhage, external or the internal, then suddenly there is a loss of the blood, but whatever the blood remaining in the body will have the normocytes, they have even the normal hemoglobin. But when you check for hemoglobin, it will be reduced, but each RBC will be having a normal hemoglobin concentration. So this is the normocytic anemia. Laboratory investigations needed in anemia are HB percentage, PCV, fat cell volume, mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, red cell distribution, width, and the peripheral cell. So, in the next video, we will see about how to interpret these laboratory investigation with the different types of anemia. So, in this video, we discussed about what is anemia, causative factors of anemia, signs and symptoms of anemia, and the types of anemia.